Medical errors in mental health treatment are a critical issue that demands our attention. This episode is a companion to the Medical Errors course offered by Therapy Trainings, tailored for mental health professionals, counselors, and therapists. You will gain insights into the common types of medical errors, understand the contributing factors, assess their potential consequences, and learn strategies for prevention and mitigation. This knowledge will be invaluable in enhancing the quality and safety of your practice. So, what exactly can you expect to learn in this episode? First, we'll identify the various types of medical errors that can occur in mental health treatment. Then, we'll discuss the underlying factors that contribute to these errors, shining a light on how systemic issues often play a significant role. After that, we'll explore the consequences of these errors, both for patients and for the professionals involved. Finally, we'll wrap up by discussing strategies to prevent these errors and improve communication within our multidisciplinary teams. It's a lot to cover, so let's get started. To kick things off, let's talk about the common types of medical errors we might encounter in mental health treatment. It's essential to recognize that medical errors can manifest in various forms and may not always be as straightforward as a misdiagnosis. For instance, one common type of error in mental health is the misinterpretation of a patient's symptoms. Imagine a scenario where a patient presents with symptoms that could be indicative of multiple disorders. If a clinician rushes to a conclusion or fails to gather a comprehensive history, they might end up diagnosing the wrong condition, which can lead to inappropriate treatment plans. Another prevalent error is the improper prescribing of medication. Mental health medications often come with a myriad of side effects and interactions, making it critical for professionals to be diligent when prescribing. One slip-up, such as overlooking a patient's current medications or allergies, can result in serious repercussions. It's alarming to think how a simple oversight can spiral into a significant health risk for a patient. Additionally, we should consider communication errors, which are especially common in multidisciplinary teams. For example, if a therapist fails to communicate a patient's progress or setbacks to a psychiatrist, the psychiatrist might make treatment decisions based on incomplete information. This is where we start to see how interconnected our roles are and why clear communication is paramount. Now let's transition to the factors that contribute to these medical errors. It's essential to understand that these errors rarely occur in a vacuum. Instead, they are often the result of systemic issues within healthcare, such as high caseloads, time constraints, and inadequate training. Think about the last time you felt rushed during a session or overwhelmed by paperwork. When professionals are stretched thin, the risk of making mistakes increases significantly. Moreover, a lack of standardized protocols can lead to inconsistencies in treatment. Each clinician may have their own approach to handling similar situations, which can result in varied patient outcomes. Establishing clear guidelines and protocols can help mitigate this issue. Another contributing factor is the stigma surrounding mental health treatment itself. Many mental health professionals may feel hesitant to report errors due to fear of judgment or repercussions. This silence can perpetuate a culture where learning from mistakes becomes difficult. It's important to foster an environment of open communication and support where professionals can discuss errors without fear of repercussion. This not only helps the individual grow, but also enhances the overall safety of the treatment environment. Now let's take a moment to recognize the potential consequences of medical errors, both for IANTs and healthcare providers. For patients, the repercussions can be devastating. An incorrect diagnosis can lead to inappropriate treatment, worsening symptoms, and a decline in overall mental health. The emotional toll on patients can be profound as they navigate the challenges of a misdiagnosis or inadequate care. For healthcare providers, the consequences can be equally significant. Beyond the potential legal implications, there is the emotional weight of knowing that a mistake was made. This can lead to feelings of guilt, shame, and burnout. It's a heavy burden to carry, particularly in a field where empathy and connection are vital. So, how do we address these issues? Let's talk about some strategies for preventing and mitigating medical errors in mental health treatment. First and foremost, improving communication skills is essential. Take a moment to reflect on your own communication style. How often do you check in with colleagues about patient care? Establishing regular team meetings or case consultations can foster a culture of collaboration and ensure that everyone is on the same page regarding treatment plans. Additionally, developing a robust system for error reporting is crucial. Many organizations have adopted non-punitive reporting systems to encourage professionals to report mistakes without fear of judgment. This creates a valuable opportunity for learning and improvement, ultimately enhancing patient safety. Training is also key. Ongoing education focused on best practices can help clinicians stay up to date with the latest research and treatment modalities. Therapy Trainings offers a variety of courses that can help you sharpen your skills and knowledge in this area. For instance, the course on medical errors covers these topics in detail, equipping you with the tools you need to navigate this complex landscape. Let's also talk about the importance of self-care. As mental health professionals, we often prioritize our clients' needs above our own, but neglecting our well-being can lead to burnout. Burnout not only affects your mental health, but can also impair your ability to provide quality care. Taking time for self-care, whether through mindfulness practices, regular breaks, or support groups, can enhance your resilience and, in turn, improve the care you provide to your clients. Now, let's address some common misconceptions related to medical errors in mental health treatment. One prevalent myth is that medical errors only occur in physical health settings. This couldn't be further from the truth. Mental health treatment is nuanced and complex, making it just as susceptible to errors as any other medical field. By acknowledging this, we can begin to take proactive steps to address and prevent these errors. Another misconception is that admitting to an error is a sign of weakness. In reality, acknowledging a mistake is a courageous step toward improvement. It shows a commitment to patient safety and a willingness to learn. We need to reshape this narrative within our professional culture to encourage honesty and growth. As we wrap up today's episode, let's take a moment to reflect on the key points we've covered. We identified common types of medical errors, such as misdiagnoses and improper prescribing. We explored the systemic factors that contribute to these errors, including high caseloads and communication barriers. We also discussed the potential consequences for both patients and providers, emphasizing the importance of a supportive environment that encourages open dialogue about errors. Finally, we shared strategies to prevent and mitigate medical errors, from improving communication skills to fostering a culture of reporting and learning. Remember, enhancing patient safety is a shared responsibility that requires collaboration within our multidisciplinary teams. I encourage you to delve deeper into this topic by checking out the course on medical errors offered by Therapy Trainings at therapytrainings.com. The more we learn and share, the better equipped we'll be to provide safe, effective care for our clients. Thank you for joining me today. Let's continue to challenge ourselves, support one another, and strive for excellence in our practice. Until next time, take care of yourselves and each other.